That endless thump, thump, thump of your dog's leg hitting the floor, it's not just worrying, it's frustrating, right? It's so hard to watch them be that uncomfortable, and you just feel, well, helpless.
So if that sound, the scratching, the licking, the chewing, has pretty much become the soundtrack to your life, then you are absolutely in the right place. Because that nonstop discomfort, it's more than just an annoyance. It's your dog telling you loud and clear that something's not right.
All right, so for the next few minutes, let's you and I put on our detective hats. We're going to go on a little investigation, track down the clues, figure out who the real culprits are behind all that itching, and, most importantly, create an action plan to get them some relief.
First up on our investigation, we're going after the most common offender out there, parasites. You know, these are the little criminals that vets almost always check for first, and the crazy thing is, they're often hiding right in plain sight.
Yeah, you heard that right. When it comes to itchy skin, what's the #1 reason dogs end up at the vet? Fleas. Vets will tell you they are the most common cause of what they call pruritus, which is just the fancy word for itchiness. So they're always suspect #1 that you gotta rule out.
And here's the thing you really need to get. For a lot of dogs, it's not about being infested with tons of fleas. The real problem is something called flea allergy dermatitis, or FAD. What happens is their immune system just goes haywire over the proteins in the flea's saliva. It triggers this massive, intense allergic reaction.
And get this is what's truly mind-blowing about FAD. It's the power of this allergy. Like PetMD points out, it can take just one single flea bite to set off a huge body-wide inflammatory reaction in a dog that's allergic. We're talking days, maybe even weeks of pure misery from one tiny bite.
So what should you be looking for? Well, the signs of FAD are pretty classic. The big one is that frantic itching. But pay attention to where they're itching. It's usually on their back half. Think lower back, right at the base of the tail, and down their thighs. Oh, and here's a huge telltale sign. Look for reddish-brown staining on their fur. That's from all the saliva from constant licking.
Okay, so let's say you've checked for fleas, you're using prevention, and you're pretty sure that's not it, but your dog is still scratching like crazy. Well, now we move on to culprit #2. This time, we're hunting for an invisible enemy. Allergens. These could be floating in the air or, even hiding in their food bowl.
When it comes to allergies in dogs, you can basically split them into two main camps. First, you've got your environmental allergies, also called atopy. This is when they react to things they breathe in or touch, like pollen, dust mites, you name it. Then, in the other camp, you have food allergies. This is a reaction to an ingredient in their food, and it's almost always a protein. Think chicken, beef, that kind of thing. Both make them itchy, for sure, but how you figure out which one it is and how you treat it, totally different.
And this number, 8 to 12 weeks, this really shows you the biggest challenge when you suspect a food allergy. It all comes down to patience. Your vet will likely suggest a super strict elimination diet. And when I say strict, I mean you have to stick to that new food and only that new food for at least 2 to 3 months to see if things improve. It's a huge commitment, no doubt, but it's really the only way, the gold standard, to get a definitive answer.
You know, it doesn't really matter what starts the itch, whether it's fleas or allergies. That initial itch is just the spark. The real fire starts with what the dog does next. Scratch, and lick, and chew. And that's when things can spiral out of control into a really nasty, vicious cycle of damage and infection.
And a perfect example of that cycle? The dreaded hotspot. Ugh, if you've ever dealt with one, you know. It's this angry, raw, painful, and infected area of skin that can pop up and get huge in just a matter of hours. And it's caused completely by the dog traumatizing their own skin, just trying to get some relief from that awful itch.
Here's a good way to think about it. Your dog's skin is like a brick wall, right? It's their first line of defense against everything. The itch is the first problem, sure, but all that non-stop scratching and chewing, that's like taking a sledgehammer to that brick wall. It just breaks down that protective barrier and leaves the door wide open for other invaders to get in.
And here are those invaders I was talking about. See, once that skin barrier is compromised, the bacteria and yeast that are normally just hanging out on the skin can suddenly go into overdrive. They start to overgrow, and boom, you've got a secondary infection. And that yeast malassezia, that's what's behind that, that corn chip or Frito feet smell you might notice. The worst part? Both of these infections make the itching even worse, which just keeps that whole vicious cycle going.
All right, we've tracked down the culprits, we've seen the damage they can do. Now it's time for the most important part of this whole thing, the relief plan. Let's talk about exactly what you can do to break that itch cycle and finally get your pup some comfort.
And the great news is there are things you can start doing at home, like right now. Soothing baths with a colloidal oatmeal shampoo can do wonders for calming down that inflammation. Adding omega-3 fatty acids like from fish oil helps rebuild that skin barrier from the inside. And it's always a good idea to have a safe topical spray like Vetericyn on hand to soothe those really angry hot spots while they're healing.
Now, I know what you're thinking because pretty much every dog owner asks this. Can I just give my dog a Benadryl? And while it's true, some human antihistamines are used for dogs, it is absolutely not as simple as just giving them one of your pills. For one, they don't always work that well for this kind of itching. And more importantly, safety has to be number one.
So you might see a chart like this online and think, oh, great, I can just figure out the dose myself. Please, I cannot stress this enough. Do not do that. Your vet is the only person who should be telling you what to give your dog. The right medication, the right dose. It all depends on your dog's weight, their health, other meds they're on. Getting it wrong isn't just a bad idea, it can be really, really dangerous.
Look, at-home care is great for providing some comfort, but there are some definite red flags, some signs that are just non-negotiable. If their skin is already looking bad, I mean red, scabby, or if it has a weird smell, it's time for the vet. If the itching is so severe that your dog just can't get comfortable, or you see painful hot spots forming, you need to make that call. Don't try to wait it out.
And the reason you call the vet is because they have a whole arsenal of really effective tools that can shut down that itch cycle fast. I'm talking about powerful prescription meds like Apoquel, which works by targeting the itch signals directly, or an injection like Cytopoint, which actually neutralizes the main protein that causes the itch in the first place. These things can provide relief sometimes within hours, which finally gives that poor, irritated skin a chance to heal.
So there you have it. We've gone from investigating tiny parasites to invisible allergens, all the way to nasty secondary infections. You've got the intel now. You know what to look for, so the only question left is, are you ready to use it to build a rock-solid, itch-free defense for your best friend?